It is now my honor to introduce our opening keynote presenter, Dr. Camara Jones, to all of you. Dr. Jones is a past president of the American Public Health Association and was the 2019-2020 Evelyn Green Davis Fellow at the Radcliffe Institute for Advanced Study at Harvard University. Her allegories on race and racism illuminate topics that are otherwise difficult for many Americans to understand or discuss. Recognizing that racism saps the strength of the whole society through the waste of human resources, she aims to mobilize and engage all Americans in a national campaign against racism. And she is a renowned public health expert and has done work for many, many years on health equity and race. And so I would now turn it over to Dr. Jones.
Thank you so much, Jamie. And I'm really delighted to be here helping to launch our discussions. And thank you, Dr. Plow, for your welcoming remarks. Let me start sharing my screen. I have an hour for our conversation, but what I'm going to do is just seed the conversation with some ideas for 30 minutes and then count on you to be asking questions of me and of each other, and that we'll get into a robust discussion. The reason I say that is I actually took out something that I love to share. I took it out. If you guys ask me to share it, and I'll tell you what it is when I have a placeholder for it. If you ask me to share it during the Q&A, I will, but I really, really understand what we're doing here. We're a small group. We're all focused on the same thing. We're focused on making sure that climate justice is racial justice, that climate justice is Indigenous peoples' justice, that climate justice is justice, because if we just do a little bit of climate here and there, we might get the same unjust distributions of outcomes and opportunities that are replicated in this society over centuries. So I entitled my remarks, Naming Racism and Moving to Action, which is necessary for us to achieve health and climate justice. And as Jamie said, I have been out in the vineyard working for decades to get folks to name racism, ask how is racism operating here, and then organize and strategize to act. And there are more and more groups that are naming racism now. You may be aware that there are at least 183 jurisdictions across the nation that have made formal declarations that racism is a public health crisis. And about a month ago, the CDC director, Dr. Rochelle Walensky, actually said that racism is a serious threat to the health of the public. So what is needed when we name racism? The first thing is that all of our messages have to be clear that racism exists, because there are many people in this country that are still in staunch racism denial. But after we say that racism exists, we need to make sure that people understand that racism is a system. We're not talking about an individual character flaw or a personal moral failing. And then we need to make sure that people understand that racism saps the strength of the whole society. And finally, that we can act to dismantle racism. So if I had 2 hours with you, I would actually share a separate allegory, a separate teaching story for each of those 4 messages. I'm just going to share allegories right now for the first 2, that racism exists and that racism is a system. And here's the first of those. So I'll tell you already, this story, this teaching story that I call Dual Reality, a restaurant saga, has the moral that racism exists. So sorry for the spoiler alert, but here we are. And it was based on my own real life experience when I was a first-year medical student. So come into my life as a first-year medical student. Here I am one Saturday, because of course, on Saturdays, I would wake up early and I would hit the books because I was very studious, very diligent. So I had been studying for many hours. It was about mid-afternoon and some friends came over. And did they distract me from my studies? Oh, no. Oh, no. We all got to studying long and hard. And now it was getting late. And we were getting hungry, and I had no food in the apartment, which was so typical that my friends understood. They were like, okay, Camara, never mind, but we are hungry. Let's go into town and find something to eat. So we do. We walk into town and we find a restaurant and we walk in and we sit down. And the menus are presented. And we order our food and the food is served. And here we are eating. So you're like, oh, that's not the story about racism in a restaurant that I was expecting. Oh, no, but hold on. As I sat there with my friends eating, I looked across the room and I noticed a sign that was a startling revelation to me about racism. So now maybe I've intrigued you and you're wondering, Dr. Jones, what did the sign say? Okay, well, what did the sign say? The sign said open. So now maybe I've lost some of you. So let me recap. Here we are sitting in a restaurant eating. I look across the room. I see a sign that says open, thinking no more about it. I would assume that other hungry people could walk in, sit down, order their food and eat. But because I knew something about the two-sided nature of those signs, I recognized that now, in fact, the restaurant was closed due to the hour, but firmly closed, and that other hungry people, just a few feet away from me, but on the other side of the sign, would not be able to come in, sit down and order their food and eat. That's when I recognized that racism is structuring open, closed signs in our society, that racism is structuring, if you will, a dual reality. And for those who are sitting inside the restaurant at the table of opportunity eating, and they look up and they see a sign that says open, they don't even recognize that there's a two-sided sign going on because it is difficult for any of us to recognize a system of inequity that privileges us. So, for example, it is difficult for men to recognize male privilege and sexism. It's difficult for white Americans to recognize white privilege and racism. In fact, it's difficult for all Americans to recognize our American privilege in the global context. Although if we just had the eyes to see, we would recognize that right now in the availability of vaccine, how we kind of sucked up so much of the global vaccine supply right now. However, those on the outside are very well aware that there's a two-sided sign going on because it proclaims closed to them, but they can look through the window and see people inside eating. So back inside the restaurant, to those who ask, is there really a two-sided sign? Does racism really exist? I say, I know it's hard for you to know when you only see open. In fact, that's part of your privilege, not to have to know. But once you do know, you can choose to act. So it's not a scary thing to name racism. It's actually an empowering thing to name racism. It doesn't even compel you to act, but it does equip you to act so that if you care about those on the other side of the sign, which is an if, but if you do, why, you could even talk to the restaurant owner who is, after all, inside with you. And you could say, restaurant owner, there are hungry people outside. Why don't you open the door and let them come in? You'll make more money. And oh, the conversations we could have. Or maybe what you'll do is pass some food through the window. Or maybe you'll try to tear down that sign and break through the door. But at least what you won't be doing is sitting back saying, wonder why those people don't just come on in and sit down and eat. Because you'll understand something about the two-sided nature of that sign. So when I only have 4 or 5 minutes to convey to a group of people that racism exists, that is structuring a two-sided or multi-sided sign, that is structuring a dual or multifaceted reality, this is the story that I tell. And I have to tell you, in my now a few years of telling this story, I have actually started a 3-hour conversation on 2 occasions, 3-hour conversation with the following question. How could people who are born inside the restaurant know something about the two-sided nature of that sign? And these have been 3-hour conversations because there are many, many ways to know. I am heartened that these days in this year, that, this past 15 months, there are more people who are born inside the restaurant who've gotten a sense, an inkling about the two-sided nature of the sign because of the disproportionate impact of COVID-19 on communities of color, because of the very highly publicized and gruesomely documented murder, not only of Mr. George Floyd, but of many, many other Black and brown men and women by the police. So there are more people born inside the restaurant who just a year ago would have been sitting inside eating and then saying, well, what are those people saying outside? Black Lives Matter? Don't they know that all lives matter? Who are now affirming, yes, Black Lives Matter. There are more people who are born inside the restaurant saying the word racism and even saying the word structural racism or systemic racism. This is very heartening. But I have a warning for us. And that warning is that if we just say a thing, put a statement on our website, put something on Facebook or whatever, if we just say a thing, racism denial in this country is so staunchly held by many and so seductive that if we just say a thing 6 months from now, we may forget why we said that thing and fall back into what I describe as the sleepiness, the somnolence of racism denial. So we have to go beyond naming racism. Naming racism is very important, right? It's essential because you have to name a problem in order to address the problem. But if we just name racism, we might forget. So we need to go beyond naming racism and move to action, which means that we need to tear down that sign. And of course, racism is not just a sign. It's a sign, it's a door, it's a lock, it's a whole system. So we need to dismantle that lock, take the door off the hinges, because if we start acting, we will not forget why we are acting. So now I would like to share with you my definition of racism, which starts out acknowledging every time I say the word racism, I'm talking about a system. As I said, racism, I'm not talking about an individual character flaw, a personal moral failing, a psychiatric illness, as some people have suggested. And surely racism can manifest in those ways. But in its essence, racism is a system of power and a system of doing what? A system of both structuring opportunity and assigning value. And on what basis is the opportunity structured and on what basis is the value assigned? It's based on the social interpretation of how one looks, which is what we call race in this country. And actually, as an epidemiologist, I have developed a measure that I call socially assigned race, where the question is, how do other people usually classify you in this country? Would you say white, Black or African American, Hispanic or Latino, Asian, Native Hawaiian or Pacific Islander, American Indian or Alaska Native, or some other group? In other words, that measure takes all of the Office of Management and Budget federal racial categories plus the OMB federal ethnicity category and puts it all together, because this question, this socially assigned race is the race on which racism operates, the substrate on which racism operates for centuries and clearly day to day, without anybody asking the question, excuse me, how do you self-identify? Or excuse me, where were you born? Where were your parents born? Or even, excuse me, may I have a little aliquot of your blood? I have a genetic hypothesis. So this social interpretation of how one looks, that is the substrate on which racism operates day to day to do two things: structure opportunity and assign value. And this system has three impacts. The first, most of us could guess, that racism is unfairly disadvantaging some individuals and communities, because when we think or talk about racism, that's usually what we think of. But it shouldn't take us long to recognize that every unfair disadvantage has its reciprocal unfair advantage. So that racism is also unfairly advantaging other individuals and communities. And that's the whole issue of unearned white privilege that we hardly ever talk about in this country, because it makes some people, especially some people who are living as white, uncomfortable. And when I used to, back in the day, I would share this part of my definition, and I would be in a room full of people when we were doing that, and I would see people start to fidget, and I would say, I would almost apologize. I'd say, I'm not trying to make anybody uncomfortable. If you feel uncomfortable, shake it off, stay with me. I'll tell you some more stories. I don't apologize anymore. What I say is, when I talk about how racism unfairly advantages some individuals and communities, when I talk about unearned white privilege, if that makes anybody feel uncomfortable, I encourage you to lean into that discomfort, because I have come to recognize that for each of us, the edge of our comfort is actually our growing edge. But there's a third impact of racism that many of us miss, and that is that racism saps the strength of the whole society through the waste of human resources. And we have many examples of that. when we don't vigorously invest in the full, excellent public education of all of our kids, because the blinders of racism have made some folks think that there's no genius in the barrios and the ghettos on the reservations. We can get along very well, thank you, without those kids, when of course there is genius in all of our communities. And if we were to only vigorously invest in that genius, we could be doing so much better as a nation or even as a world. When we are complacent with what I describe as the wholesale warehousing disproportionately of so many Black and brown men in our prison system, as if that didn't separate us from human potential, right? These are ways that racism is sapping the strength of the whole society. And this impact of racism is actually the one, even when we invisibilize it, indigenous people in our society, invisibilize, act as if, as if this land, as if we were all immigrants here. Right? Okay. So anyway, I could talk into this one slide for 10 minutes. Not going to do it because I'm trying to get through with all of my remarks in 30 minutes so we can talk. But what I have to say is that this third impact of racism, how it saps the strength of the whole society, is actually the impact that I think we need to lift up most urgently these days. We need to have more media stories about how racism is sapping the strength of the whole society. In fact, there was one story that I heard, a study, sorry that I don't remember the authors, but a study that said that if we had done reparations for African Americans before the COVID-19 pandemic, then there would have been many hundreds of thousands of lives in many, many different communities saved during the pandemic. So that kind of story needs to be elevated. We need to be doing more data collection about that. We need to have more conversations around our dinner tables about how racism saps the strength of the whole society, so that more people will feel a sense of urgency to dismantle this system and put in its place a system in which all people can know and develop to our full potential. This is the point at which I might, if I had an hour or an hour and a half or 2 hours, I would love to share with you my Gardner's Tale allegory that describes 3 levels of racism: institutionalized or structural, personally mediated or interpersonal, and internalized. And the message, the moral of that story, is that we must address the structural racism if we're going to set things right in the society. And if we do address the structural racism, the other levels may take care of themselves. There's a 4-page paper that you can read. There's a 18-minute video, which with a very early version of the story. This video that I have here was actually recorded in 2002, so that's now 19 years ago. But also, if we get a lull in our conversation and any of you wants to ask me during the Q&A to share a quick version of the Gardner's Tale, I would be delighted to do that. This story, which was published in 2000, is kind of the foundational allegory for all of my work. But what I'm making room for by not telling it fully right now is for my newest allegory that most of you will never have heard of. This one I call Cement Dust in Our Lungs. And this one is to illustrate the important truth that we must address racism as a system if we're going to set things right. So in this allegory, I'm going to be talking about cement dust in our lungs, right? And so we're going to be talking about environmental stuff. And I also want you to understand that the cement dust is a metaphor for racism. So here we are. Imagine that there's a cement factory spewing cement dust that fills the air. And if you're anywhere around that factory for any amount of time, you're going to get cement dust in your lungs. And this cement dust in our lungs is problematic for all of us. It may affect us differently. In fact, the cement dust in my lungs might make me feel that I'm less than, right? Well, while the cement dust in somebody else's lungs might make him feel that he can, with impunity, crush the life out of another human being with his knee for 9 minutes and 29 seconds. But for all of us, the cement dust is problematic. And for those of us who recognize that we have the cement dust in our lungs, because there are a lot of people who are oblivious to the dust in the lungs and the cloud and all of it, we might ask, what can we do? Do we focus on the individual when we recognize that there's cement dust in all of our lungs? Well, one way of focusing on the individual would be to maybe screen people for how much cement dust they have in their lungs. And then if somebody has too much dust, some kind of alarm goes off, and then we would think about, segregating them off to a different part of society. This is not a good idea. This is not a good idea. this is the reason that people don't even want to talk about racism, right? Because there are many people who think that when you say the word racism, that you are actually trying to divide the room into who's racist and who's not, or peer deeply into their soul to ask exactly how racist are you, right? So I don't think that this is a good idea. But there are those of us who do recognize that we have cement dust in our lungs who might want to clear that dust out. So at the individual level, maybe we would seek a cleansing spa, right? So maybe I wanted to go in and get the dust cleaned out at the individual level. This might be a training or whatever. And I'm coming out as good as new, but when I come back into that cloud, the cement dust reaccumulates. So I think that so far we don't have really good answers at the individual level, just paying attention to the dust in our lungs. So, well, maybe we should focus on the cloud, because after all, we weren't born with dust in our lungs. It is coming from somewhere. So maybe the culture or the environment, right? So if I recognize that I have cement dust in my lungs, but it's not because I was born that way, but there is a cloud of cement dust, I might choose to put on a gas mask. That is, start my individual anti-racism journey, right? Recognizing that the gas mask is going to filter more dust from getting into my lungs, but it's not going to extract out of my lungs the dust that's already there. But with this individual anti-racism journey, it's really important for me to keep this gas mask on. And when I see myself reflected in a mirror or a glass, it's good for all of us. Actually, first of all, it's going to remind me I am living in a cloud of cement dust. But also, when you see me with my gas mask on, you're going to ask, well, Dr. Jones, why are you wearing a gas mask? And I'll say, well, we're living in a cloud of cement dust. Racism is everywhere. And so then more and more of you may choose to put a gas mask on. And this is important. So is that the answer? Are we going to try to create lots of gas masks, little baby-sized gas masks, old people gas masks, and have all of us wearing gas masks? Well, that might work in the short term, but I don't think that is the sufficient answer, because the cloud still exists. So I suggest that we need to focus on the factory. We need to acknowledge that the dust doesn't just, come from nowhere, even though with all of this dust in the air, it is hard to discern the structures, the systems that are spewing the dust. But when we focus on the factory, especially those of us who are wearing the gas mask, we need to get closer to that factory and start discerning it and start asking, how is this factory working here? How is racism operating here? Looking at the mechanisms of spewing the cement dust. And when we do, then we need to organize and strategize to act on those levers for intervention, those targets for action, and put in its place to dismantle that system and put in its place a system in which all people can know and develop to their full potentials. The point of this allegory is to say that we can recognize racism in us, around us and all, but in order to set things right, we must go and address the structural factors that are spewing the dust, which is then infecting the people. So every time I tell that story, because it's so new, I tell it a different way. I would love to find out from you in our Q&A if you had some ahas or things you wanted me to make more explicit or whatever, because I have not yet published this story. And as I say, I've maybe told it 30 times. So anyway, you guys are part of the new audience. But in that story, I lifted up a very important question, which is, how is racism operating here? Right? And that's an important question, because racism is not just a cloud, a miasma that we can't get a handle on. It is a system with identifiable and addressable mechanisms, which are in our structures, policies, practices, norms, and values, which are actually different elements of decision-making, where the structures are the who, what, when, and where of decision-making, especially who's at the table and who's not, and what's on the agenda and what's not. And from now on, whenever you find yourself at a decision-making table or are setting one, I encourage you to take a look around. First thing, to ask, well, who is not here? Who has an interest in this proceeding? And then your job is not just to represent their interest, although you might have to do that in the short term, but your job is really to create space, to find them a way and a place, a seat at the table. And if structures are the who, what, when, and where of decision-making, policies are the written how of decision-making, practices and norms are the unwritten how of decision-making, and values are the why. And so I encourage us to take this question with us everywhere. How is racism operating here in my child's school? How is racism operating here in my work? How is racism operating here in this collective that we're working in right now? How is it operating in my city, in this country? And I have answered this question: how is racism operating here with regard to police killings of unarmed Black, brown, and red men and women, in this country? How is racism operating here with the disproportionate impact of COVID-19 on communities of color? How is racism operating here with regard to the limited access of children of color to nature? How is racism operating here in terms of clinical trials and on and on? And so here's my first shot at answering the question: how is racism operating here with regard to climate change, health, and communities of color? And I offer this as a starting place for your conversations to identify levers for intervention, targets for action, recognizing that you all who are doing the work will be able to go beyond my few little ideas to enhance this list and start organizing and strategizing to act on these mechanisms. So with regard to structures, which are the who, what, when, and where of decision-making, well, actually, all of that has resulted in racial segregation coupled with disinvestment, which has then led to concentrated poverty and substandard housing in communities of color. Racial segregation is important to the extent that it makes disinvestment easy, right? And that has then led to greater susceptibility to heat events, to wind events, to flooding, which are happening because of climate change. With regard to policies, the written how of decision-making, well, flood insurance policies, different FEMA policies result in incomplete recovery, increased poverty, and further degradation of living situations of communities of color. With regard to practices, the very well-known, the EPA has a term, sacrifice zones, to describe communities living in close proximity to known polluting entities. And communities of color are disproportionately labeled as sacrifice zones, resulting in poor air quality, poisoned water, insufficient green space, and the like. With regard to norms, where this nation's narrow focus on the individual, our ahistorical stance, our myth of meritocracy, and I'm going to go a little bit more deeply into each of those when I talk about barriers to achieving health equity, but these norms underlie racism denial. Narrow focus on the individual makes systems and structures invisible or irrelevant. Racism, what is a system? What system? The ahistorical stance, the myth of meritocracy, saying that if you don't make it, it's, taking the present as disconnected from the past. The distribution of advantage and disadvantage is just a happenstance, results in victim blaming for the situations in which we find ourselves and normalization of the dual reality. Normalization of the dual reality. There is no two-sided sign and door nor lock. And the values underlying this nation, including white supremacist ideology, which is belief in the false hierarchy of human valuation by race with white people living as white at the top, results in indifference and inaction in the face of need, which is how structural racism very often manifests these days. I would love to engage in more conversation with you about some of those and throwing some more things into the pot. So I'm going to shift gears just a minute to first of all talk about what is inequity. Now, that definition that I gave you of racism can actually be generalized to be a definition of any system of structured inequity. So what is sexism, for example? Well, that's a system of structuring opportunity and assigning value based on gender that unfairly disadvantages some individuals and communities, unfairly advantages other individuals and communities, and saps the strength of the whole society through the waste of human resources. And there are many axes of inequity operating in our society today, intersecting in communities, intersecting in individuals. And all of these are at least risk markers for how opportunity is structured and value is assigned, even as a smaller subset of them are also risk factors in the progression to disease. Now, people might be amazed, Dr. Jones, all this, your whole career has been about race as the axis of inequity and racism as a system of structured inequity, and you come to tell me that you recognize that all of this other stuff is going on? Dr. Jones, why are you so fixated on race and racism? Well, I do recognize that all of this is going on, but I have focused my work on race as the axis of inequity and racism as the system of structural inequity, because racism is foundational in our nation's history, and yet many people are in staunch denial of its continued existence and profoundly negative impacts on the health and well-being of the nation. And I actually believe that all of us need to at least be actively anti-racism. And you recognize that I don't say anti-racist, but anti-racism, that all of us need to be actively anti-racism, even as we engage in these other struggles, right? And to the extent that we are able to dismantle the mechanisms of racism, the other struggles will benefit as well. What is health equity? Because this whole convening is about equity, climate, and health. Well, I'd like to share with you very briefly my three-part definition of health equity. What is it? How do we get there? And how is it related to health disparities? And this definition is very closely related to what was the Healthy People 2020 definition of health equity, closely related because I helped write that 2020 definition. But then, those government definitions go through clearance, and I can keep thinking, and I have PowerPoint, so I can tweak my definitions along the way. So I'll tell you what the main difference is right now. I define health equity as assurance of the conditions for optimal health for all people. Healthy People 2020 defined health equity as attainment of the highest level of health for all people. I agree that that's our goal, but what troubles me about that as a definition of health equity, if we miraculously met that last Sunday, are we done? And it is clear to me that health equity is not an outcome, it's a process. Which process? Assurance, which is actually one of the three core functions of public health identified by the Institute of Medicine, along with assessment and policy development. Assurance of what? Of the conditions for optimal health, what some people describe as the social determinants of health, the context of our lives. For whom? For all people. That's what makes it equity. There's a distinction between the social determinants of health, the context of our lives, and the social determinants of equity, the systems of power that create the range of contexts that we see, and then differentially distribute different populations into those contexts, where those social determinants of equity include racism, sexism, heterosexism, economic systems like capitalism, and the like. So how do we get to health equity? Well, achieving health equity requires at least these three things: valuing all individuals and populations equally, recognizing and rectifying historical injustices, and providing resources according to need. How are health disparities related to health equity? Health disparities will be eliminated when health equity is achieved. Health disparities are the differences in outcomes. Health equity is all that opportunity structure stuff that came before. And if you are wondering if your efforts are toward achieving health equity, ask yourself, are we doing these three principles? Are we valuing all individuals and populations equally? And you say, well, how do I operationalize that? Well, think about the word valuing and how you might value your children or your nieces or nephews, where you would invest in them. You would protect them. You would invite their opinion. You would elevate them, celebrate them, all of those ways. We could come up with 30 valuing terms right now. I encourage you guys to do that in your various teams. And then you have to say, am I doing that for all individuals and populations equally? Then the second principle, are you recognizing and rectifying historical injustices, which starts with learning history, even learning history about your own community or your own organization that you're working in, not just the national history or even the global history. So recognize and then rectify historical injustices. Don't be afraid of making that step. Don't be afraid of the word reparations, honey. No. Right? Okay, we can have a conversation about that. The third principle that you just say, am I doing this, is providing resources according to need. When we value everyone equally, then we provide resources according to need. Two things to operationalize that. The first is there should be some metric of need that we all agree on. So maybe it's the numbers of COVID-19 deaths per 100,000 population, or maybe it's the maternal mortality rates, which disproportionately impact Black and Indigenous women, 3 to 8 times more mothers dying or would-be mothers dying in pregnancy or within the year after pregnancy compared to white populations. Or maybe it's the level of air quality or water quality, the lead in your water. Or maybe it's, the frequency of storms in your community, or the fact that you are called a sacrifice zone, right? But whatever it is, we recognize, okay, we all agree, this need, we're agreeing this is the metric of need that we're going to work with. But then the hardest part is then when you get some resources, sometimes people lose that idea of that metric of need. And say you're a health officer with 5 counties in a state and you get $1 million, your first instinct is to give $200,000 to each of those 5 counties, but you need to have the political spine to say to County A, you won't be getting any this year, and maybe not even the next year, because County E needs that more, right? And so that political spine is the other thing that we need to have. So now I want to share with you, and let me just check my time. Okay, so I think I'm going to be doing well on the half an hour and then get to the other half hour. So I have distilled now 7 barriers to achieving health equity that at first I described as 7 societal or cultural barriers to achieving health equity. Then I published them in this Harvard Primary Care blog as the 7 values targets for anti-racism action, recognizing that racism does 2 things: it structures opportunity and it assigns value. And we have a good handle on some of the, structural targets, in terms of residential segregation coupled with disinvestment, or in terms of how we fund public schools based on local property taxes, or in terms of environmental racism and the siting of toxic dump sites or bus transfer stations in communities of color, or testing, nuclear things in the Pacific atolls and all, and the uranium mining with all of the waste in, Indian country and all of that, right? So we have some idea of the structural stuff, but the values targets, I think we've been swimming through this water and we don't recognize the water in which we swim. So the last time I described these 7 things, I described them as the 7 social delusions that undergird the intergenerational transmission of racism denial. Now there's a mouthful, but these are they. So the first 3 I already mentioned to you when I talked to you about the norms that underlie, the norms that result in racism denial. So the narrow focus on the individual, which makes systems and structures either invisible or seemingly irrelevant, it results in people's sense of self-interest being very narrowly defined. They don't even count their cousins or aunts and uncles as part of self, much less the people who live across town. It results in a limited sense of interdependence. There, but for the grace of God, go I. We are all in this together. I am my brothers and my sisters' keeper. Although you would think with regard to the climate and the planet, we could get to there, but still people are very narrowly focused on the individual, even with regard to climate issues, not just racism. And then a limited sense of collective efficacy. This is also important in the climate context because people are like, oh, well, what can I do as an individual? That's the wrong question. You can do things as individuals, but the more inclusive and productive question is, what can we do? But when we're narrowly focused on the individual, we don't even think about our collective efficacy. The second of these 7 barriers is our ahistorical stance. We act as if the present were disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. And when you are ahistorical and you're born and you see things a certain way, you think they've always been that way and they'll always have to stay that way. And so it even limits our ideas about how we can change, how we can make important change on systems and structures. The third of these 7 barriers to achieving health equity is our endorsement of the myth of meritocracy. The story that goes something like this: if you work hard, you will make it. Now, I give you that most people who have made it have worked hard, although not everybody who's made it has worked hard. And we have some prominent examples of that in our public view. But yes, most people who have made it have worked hard, but there are many, many other people working just as hard or harder who will never make it because of an uneven playing field, which has been structured and is perpetuated by racism, sexism, heterosexism, capitalism, all of these systems of structured inequity. And when we deny these systems, then we are blaming those who haven't made it as being lazy or stupid. And there are many ways to deny racism, for example. But we heard Tim Scott and then others echoing that last week. I guess it was last week or the week before, saying, the United States is not a racist country. Oh my God, right? So we've heard people say racism doesn't exist, on and on and on again. But another way to deny racism is to never say the word racism. So you might even be talking about diversity, equity, inclusion, belonging. You might be discussing cultural competence, cultural humility, structural competence, disparities, disproportionalities, even race. But if you never say the word racism in our national context of widespread and deeply held racism denial, you are complicit with that denial. More quickly on the next ones, our endorsement of the myth of a zero-sum game says that if you gain, I lose. It fosters competition over cooperation. It masks the cost of inequity, that racism and these other systems of structured inequity actually sap the strength of the whole society, and it hinders efforts to grow the pie. It's like I'm sitting at a potluck dinner. I see you coming. I don't want you anywhere near this dinner, near this table, because I think you're just going to come and eat up all the food. I don't even recognize that you're bringing all kinds of cakes and pies and roasts and salads and fruits and delicious foods with you, because I don't even value enough to see that. Our limited future orientation. Oh my God, here we are squarely in the intersection of racial justice and climate justice. The parts of the future that we can touch today, each of us, are the children and the planet. In this country, we have a disregard for the children and a usurious relationship with the planet. We do not, like many American Indian nations do, have a 7 generations hence view when we are making policy decisions. What is a 100-year impact going to be when we're thinking about our policies or our plans? We do not, like I am told Maasai people do in East Africa, the Maasai in East Africa, when they greet one another, don't say, hey, how you doing? They ask a question, how are the children? And they hope to hear back the answer, all the children are well. We don't even ask, how are the children in this nation? And if we did, we would not get the answer, all the children are well. The 6th of these 7 barriers is our endorsement of a myth of American exceptionalism. We even call it American exceptionalism. Since when does the United States get to claim all of North, Central, and South America, right? In many, many countries in America. But what we really mean is this myth of US exceptionalism, that the United States is so special, so unique, so ordained by God, that the usual rules don't apply to us, that we're entitled to having all of this vaccine right here, when many nations haven't even started immunizing any of their people, that thank God that we have stopped blocking the TRIPS waiver, the intellectual property waiver that India and South Africa brought in October of last year to the World Trade Organization. We've stopped blocking that. That's good. But this same myth of American exceptionalism has resulted in us being disinterested in learning from others. If we had only learned a little bit from other nations that very ably stomped down their COVID-19 pandemic, like Australia, like China, like, many, many, Singapore, or many others, we could have saved hundreds of thousands of lives. The 7th is the foundational barrier, values target in all of this, and that is white supremacist ideology, which is not a lightning rod term. It is a simple description of the false idea of a hierarchy of human valuation by race, with the falser notion, because there is no such hierarchy, but the false notion that if there were such a hierarchy, that would put white people at the top as the ideal or the norm. But this has given many people who are living as white in our society a sense of entitlement. It has resulted in the devaluation and dehumanization of people of color, and fear at the browning of America that is underlying a lot of our political divide today. So what can we do today? I want to just, as I close, go back to that first image I gave of, the open close sign and the dual reality. We need to actively look for evidence of two-sided signs in our society. Is there something differential going on here by race, by gender, by immigration status, by language, by rural, urban, by zip code, by religion, by any of those axes of structured inequity, any way that we slice and dice the population? We need to actively look and say, is there something differential going on there by any of those, looking not just at outcomes, but also at opportunities. We cannot be satisfied sitting inside the restaurant eating, looking up and saying, oh, well, it looks open to me. We need to go beyond that, to burst through our bubbles of experience, to experience our common humanity. Each of us lives in a bubble of experience. Our kids, our communities, our jobs, our religious or social organizations, Some of our bubbles are actually quite large with thin soap bubble boundaries. Some are smaller with thicker plexiglass boundaries. Some of our bubbles are tinted. Some of our bubbles are polarized. But whatever kind of bubble you're living in, all of us, we most often do not know that just across town, there are people who are just as kind, funny, generous, hardworking, smart as we are, who are living in very different circumstances. We need to create opportunities as individuals and as organizations for bubble bursting so that we can go across town and actually stay a while. We need to experience our common humanity in different circumstances so we can start building common cause. We need to be interested in the stories of others and then believe the stories of others without requiring cell phone or body cam footage. And then we need to join in the stories of others. And I was so heartened last year at the mobilizations after the murder of Mr. George Floyd and so many others, at many people joining in the stories of others, recognizing that all of these stories are our stories. We need to develop a sensitivity to the absence of who's not at the table, what's not on the agenda. What policies are not in place that have put in place can make things more just, more fair. We need to reveal inaction in the face of need, because inaction in the face of need, lack of action in the face of need, is how structural racism very often manifests these days. But all of the power is not just for those sitting inside the restaurant. Those of us on the outside need to know our power. We need to recognize that action is power, and especially that collective action is power, because collective action propels us, it informs us, it inspires us, it protects us. So thank you very much. I'm very interested in our conversation now. And I just want to share something that I just found today, which is that this is a resource many of you may know about, but the Movement for Black Lives had a climate summit yesterday, the Red, Black, Green New Deal Climate Summit with 6 pillars. And so I just wanted to bring this to your attention in case you weren't aware of it. But I will stop sharing now and open it up for our discussion.
Hi, Dr. Jones. Thank you for that wonderful presentation. Our first question is, would you mind sharing the gardener's tale? It's such a useful allegory.
Okay, I'm going to share it really quickly. I'll go back to slides and share it really quickly with slides, but I promise I won't stay there. You know, the reason I can't share it is because I have been telling this story for maybe 25 years. And every time I tell it, somebody adds a little tweak or I learn something more. And I try to carry all that knowledge with me. So when I used to be able to tell it in 10 minutes, now it takes 20. But I won't tell it in 20. I'm not going to tell it in 20 here. I'm going to tell it really fast. Okay, I will just say that the Gardner's tale is to illustrate 3 levels of racism, as I said: institutionalized or structural, personally mediated or interpersonal. I use the terms personally mediated because I really know that racism is a system, and this is the system mediated through people. So I don't even place it as interpersonal between people. It's the system mediated through people and internalized. So very quickly, institutionalized or structural, you know, I call it institutionalized 20 some odd years ago, but structural racism is the constellation of structures, policies, practices, norms, and values that taken together result in differential access to the goods, services, and opportunities of society by race. Is the kind of racism that doesn't require an identifiable perpetrator. It shows up as inherited disadvantage and its reciprocal inherited advantage. We see it in terms of material conditions and access to power. So examples include differential access to quality housing, education, employment, income, differential access to medical facilities, physical, financial, linguistic, differential access to a clean environment. In terms of power, differential access to information, including not only health information, but information about our own histories, differential access to resources and voice. People ask me when they see housing, education, employment, income on my slide, aren't you talking about social class? And I go through a whole thing and I said, no, in fact, that institutionalized or structural racism explains why we even see an association between social class and race in this country. They're the initial historical injustices perpetuated by present day contemporary structural factors and then perpetuated on by inaction in the face of need. And then I also, usually on this slide, go deep and say, it's not, are you anti-poverty or anti-racism? In fact, it's not, are you climate justice or racial justice? In all of these, it's both and. That if we address any of these other systems of structured inequity without also recognizing the structures, policies, practices, norms, and values that underlie structural racism, even if we're all about climate justice, it doesn't necessarily become racial justice. You know, income justice, economic justice doesn't necessarily become racial justice, because even if we equalized income today, if we didn't pay attention to the background structures and things that are in our system, embedded deeply, then in one generation, we would start to see a stratification by race in terms of income again. So structural racism is so important. That is why I say we have to at least all be anti-racism, even as we engage in the other struggles, because if we are not, then we will just replicate in our working about disability stuff and all, or we're working about, LGBT rights or anything like that. If we're not attentive to how racism is so deeply embedded in our society, then we will replicate in our work the inequities that are in our society. That's what COVID did. Okay. Anyway, personally mediated racism, very quickly. Differential assumptions about the abilities, motives, and intents of others by race, and then differential actions based on those assumptions. This is what we think of, when we hear the word racism, somebody did something to somebody, the different idea, the prejudice, the different action, the discrimination. And like personally mediated racism, well, this level, like structural, can be through acts of doing, acts of commission, as well as acts of not doing, acts of omission. But even more important is personally mediated racism can be unintentional as well as intentional. You do not have to have intended to do something racist to have had a racist impact. The third level, internalized racism, the definition here is from the point of view of members of stigmatized races as acceptance by members of stigmatized races of negative messages about our own abilities and intrinsic worth. I do acknowledge the internalized sense of entitlement that many white people walk around with as a manifestation of internalized racism. This is how it can manifest: self-devaluation, really feeling that the white man's ice is colder, this syndrome of really believing, internalizing the myth of white superiority, resignation, helplessness. Hopelessness, it turns into people of color accepting the limitations to our own full humanity of the box into which we've been placed. And so then here comes this story. But I had to give you those. So I'm going to stop sharing for a minute so you can see me really big. And then I will just come back for just one more on that. So the story starts with, and let me see, how much time do we have? Can I have 8 minutes for the story? Okay. So it starts with something that happened in my own real life. Husband and I have been married about a year, moved down to Baltimore. We're going to, I'm going to finish my PhD at Hopkins. And we bought our first freestanding house, cute little house with a big wraparound porch with flower boxes all on the porch. And when we bought this house, it was October, not the time to plant in Baltimore. So we waited. But my husband, who loves to garden, ran out when spring came, ran out with our marigold seeds, going to decorate our cute little house. And then he came right back in the house and he said, oh, well, some of these boxes have some dirt in them, but some of the boxes are empty. I need to go down to the gardening store. So he does. He goes to the gardening store. He comes back hauling big old bags of potting soil, right? And then we fill up those empty boxes. And then we take equal numbers of our marigold seeds and we put them in all of the boxes and we water all of the boxes equally. And by this time, I, who am not the gardener, am exhausted. So I just decided I'm going to sit back and be delighted. Took me 3 weeks, but 3 weeks later, I'm finally, as I walk out of my front door onto my porch, I finally pay attention to these flower boxes on my porch. And what I saw made me literally stop in my tracks, because what I saw made me think that we had planted completely different species in some boxes versus others, because some of the boxes were full of plants and they were tall, vigorous looking plants, but some of the boxes just had a few plants in them and they were kind of scrawny and scraggly looking. And then I realized what had happened. That potting soil that my husband had bought turned out to be rich, fertile soil, so that every single seed planted in the potting soil had at least sprouted. The strong seed had grown very tall and vigorous, but even the weak seed made it halfway up. But in that it turns out that soil that we had, that he found there, turned out to be poor rocky soil. So in the poor rocky soil, the weak seed that, got put in that just died. But even the strong seed in the poor rocky soil had to struggle to make it to a middling height. And so some of you guys are nodding. I see, Asia nodding right now. That's because some of you may be gardeners, right? Maybe you've composted half of your garden. Maybe you've seen this image with your own real eyes. And the image, of course, is about the importance of the soil, the importance of the environment. Now I'm going to take that image and I'm going to make it a story about racism by introducing a gardener. So now we're going to have a gardener with 2 flower boxes. One which she knows to have rich, fertile soil, one which she knows to have poor, rocky soil. And she has seed for the same kind of flowers, except some of the seed is going to produce pink blossoms and some of the seed is going to produce red blossoms. And the gardener prefers red over pink. So what does she do? She takes the red seed, puts it in the rich, fertile soil, pink seed in the poor, rocky soil. 3 weeks later, and her flower boxes. She sees what I saw in mine. In that rich, fertile soil, all the red seed sprouts, strong red seed, tall and vigorous, weak red seed makes it halfway up. In that poor rocky soil, the weak pink seed dies. Here comes the strong pink seed, struggling to make it to middling height. And then in those flower boxes, those flowers go to seed. And then the next year, the same thing happens. And then those flowers go to seed. And year after year after year after year, same thing happens until finally about, 10 years later, the gardener's looking at her flower boxes and she says, I was right to prefer red over pink. So we're going to interrupt the story there to say the first part of the story is how structural or institutionalized racism works, where you had the initial historical injustice of the separation of the seed into the two types of soil, the contemporary structural factors of the flower boxes, keeping the soil separate, and then through inaction in the face of need, perpetuation of the inequity. But let's pick the story back up to say, well, where's personally mediated racism in the garden? Well, the gardener's looking over at the red flowers thinking red is mighty beautiful. And then she looks at the pink flowers and she says, oh, those pink flowers sure are scrawny and scraggly. So she plucks off the pink blossoms before they can even go to seed. Or maybe she notices that a pink seed has blown into the rich, fertile soil. So she plucks it out before it can establish itself, which is some of the anti-affirmative action stuff that goes on. And where would internalized racism be in the garden? Well, the red flowers are just living their lives, enjoying being red, many of them not acknowledging or perhaps not even realizing that they're benefiting from enriched soil. The pink flowers looking over at red, thinking red is mighty fine and wishing with all their hearts that they too could be red. And here come the bees, minding their own business, collecting nectar, but pollinating at the same time. So here comes a bee into one of the pink flowers, and then to another pink flower, and then to this pink flower. This flower's like, get away from me, bee, don't bring me any of that pink pollen. I prefer the red, because the pink flower has internalized that red is better than pink. So now the question arises, what do we do to set things right in this garden? Well, we could start by addressing the internalized racism, so we can go over to the pink flowers and we can say, pink is beautiful, power to the pink. And that is a very important intervention. But if that's all we do, it's not going to change the situation in which the pink flowers find themselves. So you say, okay, well, maybe what we should do is address the personally mediated racism. Let's have a conversation with the gardener. Better yet, let's have a workplace multicultural workshop for the gardeners. That's all good. So we have our workshop, and in the workshop we say, dear gardener, would you please stop plucking those pink flowers? And maybe she will, and maybe she won't. Right? But even if she does, it's still not going to change the situation in which those pink flowers find themselves. What we really need to do if we want to set things right in the garden is address the structural or institutionalized racism, which means we have to break down the boxes and mix up the soil. Or if you want to keep separate boxes, it makes it all right too, although it makes it easier for that same gardener to continue segregating resources going forward. But if you decide to keep separate boxes, it means you have to enrich the poor rocky soil until it is as rich as the rich fertile soil. And when you do that, the pink flowers will flourish. They'll be looking beautiful, grand, and glorious. So that in that intervention on the structural racism, we will have also addressed the internalized racism, because pink will no longer be looking over at red, thinking red is better or wanting to be red. And in that intervention, we may also address the personally mediated racism. Now, the original gardener may have to go to her grave preferring red over pink, but her children who grow up and see the flowers equally beautiful be less likely to have that kind of attitude. So this story has been to strongly suggest that if we want to set things right in the garden, we must at least address the structural racism. Good to address all the levels at the same time, but at least address the structural. And when we do, the other levels may take care of themselves. Many questions can come out of this. I just want to say, I see the time thing. And so I just want to say that it's important to ask, who is the gardener? The gardener is the one that I gave the power to decide, power to act, control of resources, which are actually the elements of self-determination. Who is the gardener? Well, in the US context, the government is a huge part of the gardener, but not the only part. Media, foundations, corporations, communities, to the extent that they have self-determination, American Indian nations, to the extent that they have self-determination, but they also may not have, the control of resources, all of that. But what I have to say is, whoever the gardener is in any of our communities, it is dangerous when the gardener is allied with one group. I paint her red in my picture. That's why she prefers red over pink. And it's dangerous when she's not concerned with equity, when she can look at her flower boxes and think that her garden is beautiful, thank you, because she's not even counting the pink flowers as part of her garden. So we need to ask, what do we need to do about the gardener? Make the gardener stripe, polka dotted fuchsia, have the pink flowers grow or recruit their own gardener. Lots of questions that can come out of this. I would like to, hear your questions now. I don't want to keep talking.
Great. Thank you so much for that. We have time for probably one or two more questions. So our next question is, moving forward, what do you see as the role of researchers in eliminating climate inequities, and what is something researchers must improve to eliminate these inequities?
They need to be talking to the communities who are experiencing the inequities. The research shouldn't be ivory tower research. It shouldn't be, oh, I had a good idea research. The communities that are disproportionately impacted need to be driving the research agenda. The researchers need to be in service of community-originated research.
Thank you. Our next question is, as a community-based organization, what are some strategies that could be used in our work to rectify historical injustices?
Learn the history, first of all, of your organization, learn the history of the community where you're working so that you know what the historical injustices are. I mean, it sounds like a simple thing, but I was working with the Accreditation Council for Graduate Medical Education with, like 9 hospital systems. And when we asked them to learn their own history and they came back with that, they learned so much that they didn't know. We are ahistorical. So the first thing is to learn the history of the communities, learn the history of why there's a road where there is, learn the history of why there's a polluting plant where it is, learn the history, and then teach that history, share that history, because most of us won't know the history that you learn. So go deep. And so that's how you start, is you learn the history, and then you will be led to what to do about the historical injustices. I also will take a careful look at what the Biden-Harris administration is proposing in terms of historical stuff. There was something that they said, I can't even remember if it was within the transportation sector or not, but they were like really strong. I mean, they were really, maybe for houses that have been moved for interstate highways, they were going to recompense people. It was something really strong. So think strong.
Excellent. Our next question is, how do we engage socially responsible research models that center equity without exploiting the most impacted communities?
That is an interesting question, because I'm not enough into how the research would exploit unless it wasn't done with, but done on. So what I would say is, don't do research on, do research with and in service of. That would be the guidance. Like, if somebody didn't come to you and say, this is a good idea, then you have to wonder, why am I doing this? So now, of course, you have some experience, and you might go and you might ask people, is this a good idea, or is there something else that we should be working on, right? But you don't just go and say, this is a good idea, let's work on this. So you engage. It's all about who's at the decision-making table and what's on the agenda. And so our decisions need to engage people who are already trying to solve the real problems of their communities. They're not waiting for researchers to come and solve their problems. People in communities are trying to solve the problems in their communities today. It is for researchers to acknowledge the wealth of knowledge and experience and passion and insight in communities, and to join with communities in there. Don't even invite them to come and be part of your work. Center it in the communities and join the communities there. That's when your work will have real impact. And then I'll just say, as somebody who taught at the Harvard School of Public Health for 6 years, and my community-based work wasn't that valued, and the model was intellectual curiosity, and maybe this will be worth something in 20 years. And clearly mRNA viruses and that platform, that's an example of where that can work. But if there are other pressing issues and you're working on it and you're not working on the other pressing issues, then we should do all. But the thing was, as that a researcher couldn't be an advocate or even get close enough to the community that they would be perceived as an advocate. And instead, we had to write our studies, publish them in journals, and then toss them over the wall into the community and hope somebody could catch them, read them, value them, and use them. I think that's the wrong model.
Great. And I think we have one more question. So, how do we address racism within the climate field when climate has been used to invisibilize BIPOC communities as those most impacted by climate change?
Right. So we have to stop that invisibilization. And so that's why, so I was so interested. So, the Movement for Black Lives is the sponsor of this red, black, green Summit Conference that I put the thing up. You need to search that because they're going to start having weekly on Wednesdays webinars or something like that starting June 2nd. So the thing that happened either today, it's happening today or it happened yesterday, was kind of the launch where they talked about their 6 pillars and all. But this is really important work. So join with, learn from that and find out who else in your local community. I guess you guys are collectives already, so you might be working with many of the people, but maybe not all of the people in your local community. So do a, what do you call it? You know, like a landscape survey, you know, like find out who's out there. To not invisibilize. What a shame if the Robert Wood Johnson Foundation's efforts continued the invisibilization. This should be rooting out. Maybe that should be a deliverable, is to find out all of the organizations, large and small, school classes, anybody who's doing anything that relates to climate, and then pulling it all together and lifting it up.
Excellent points. Thank you so much, Dr. Jones. I will turn it back over to Jamie at this point.
Great. Thank you, Asia, and thank you, Dr. Jones. That was a wonderful presentation. And someone asked in the chat if this is being recorded, if we will share it out. We'll also share Dr. Jones's slides if she makes those available for us. We'll send you all a copy. But so much appreciation. A wonderful session as always. So thank you so much.
Thank you very much, Jamie, and have fun with the rest of the conference.
Thank you.